My name is Bob Cozzie, Cozzie.
Seems like from at least a data perspective, things today at the 911 Center are a lot better than a year ago.
Yeah, I'm really happy to say that, a couple years ago, we really hit the bottom, and we had 40 vacancies in February 2 years ago, and this year we're right on the verge of having all of our positions filled. In fact, we're filling them in this upcoming academy starting on Thursday.
Does that surprise you?
No, it's a lot of hard work, and we had anticipated that with the number of vacancies that we experienced, the increase in call volume, we looked beyond what vacant positions we had and recognized we have to be visionary and recognize we need to hire above and beyond what our day-to-day needs are. So we were able to, through vacancy savings, save money during the really lean years when it was really difficult. We were, through good policy decisions, able to save that money and create a training pipeline subfund that we're now using to fill all of those positions and actually begin to overfill positions so that we can stay ahead of attrition. We recognize, folks come and go in this profession. Public safety is a very difficult and challenging profession. Some folks stay for their entire careers and others don't. And because of that, we have to look ahead and understand how many folks we plan to lose and then hire to that number so that we can stay ahead.
When you look at the average answering time, the percentage of calls getting answered within 15 and 20 seconds, staffing figures, do you believe the worst is behind your agency?
Absolutely. What we experienced a few years ago was horribly challenging, not only for our community, but challenging for our staff here. Because of that, we experienced a lot of burnout and folks left. I mentioned earlier that we had 40 vacancies 2 years ago. When we look at all of the efforts that we've made in terms of recruitment, getting the word out, trying to spread our story, a lot of folks heard it. And because of that, through media coverage similar to this, we just told our story and we were honest and upfront. Academies now, when we hire new folks, one of the questions that I ask them is, why are you here? Why did you choose to apply for this position? And inevitably, somebody will say, Bob, we saw you on TV. We know it was difficult, and we want to be part of the solution. And sometimes, even though it's difficult and even embarrassing to share bad news like we were sharing a couple of years ago, by being upfront, being open about it, that generated interest. And almost every recruitment that we have will have at least 400 applicants that we can choose from.
What work is still ahead for you?
We want to be able to meet the national call answering standard. We're not there yet. The first couple months this year, we're hovering right now at about 19 seconds, which is right at the national standard, but it's not good enough because those are average call answering, and when we look at summer call volume, it's going to pick up. It's going to be busier, certainly during the summertime. We're going to start seeing increases in 911 call answering times. Nothing like we saw before, but we are going to see some ebbs and flows throughout the season. So really what we need to do is stay on this track, continue to hire aggressively, and be able to stay ahead of attrition so that we're able to meet that national call answering standard.
What is the biggest barrier to meeting that national standard?
Right now we have, I don't know if I'd call it a barrier, it's more of an opportunity now because we have so many trainees in the training pipeline. When you have about a third of your staff in training, you're not really answering phones as quickly as you could. As these trainees get up to speed, they're able to get better and better at their jobs, and ultimately, through the quickness, be able to improve the call answering times. In addition to that, though, our trainees don't only learn 911 call answering. They learn police dispatch, they learn fire dispatch, and that entire process takes at least a year and a half to get all the way through the program. So when we hire a trainee, we have an academy starting this Thursday. We have 10 trainees starting, and we have one previous employee who's returning. So we have 11 new folks starting this Thursday. And those 10 trainees, they're going to start in the academy. They're not going to be fully certified for another year and a half.
Are you optimistic that you can hit that national standard sometime this year?
Yeah, you know, our goal has been, we wrote it into our strategic plan, and we actually wrote it in looking at how things were going a couple years ago and how long it would take us. But because we were able to have such success with our recruitments and bringing in new folks and getting them trained and up to speed, we're actually pushing that forward. Hopefully by the end of this calendar year, we'll be hitting that goal.
You've said many times that a 911 center is the barometer of a community. Mm-hmm. What is that telling you today about Portland and Multnomah County?
Well, what I see is still a drastic increase in 911 calls compared to 2018. The reason I use 2018 is that was my first year here as the BOEC director. And when I look at that, the increase over the years, and the fact that as of the end of 2024, we had a 35% increase in 911 calls, that's astronomical, to say the least. When we think about 911 being a barometer of the condition of a community, what we're looking at is that our community isn't completely healed. Things are improving here for public safety. But we need to stay on that so that we can continue to provide the service that our community needs, in addition to our public safety partners.
How much has the rollout of 311 helped the call volume at the 911 center?
Yeah, so a lot of folks may not be aware that we answer 911 calls, but we also answer non-emergency calls. And when 311 was stood up, they began to process a lot of the calls that would normally have come to us. Calls that require referral, calls that really just for callers who need information about some kind of city service. We would have been handling those calls a few years ago. And now 311 is able to take many of those, and 311's operation has been instrumental in reducing our non-emergency workload. So the kind of the order of events, if you will, in our 911 center is we answer 911 calls first as a priority. Non-emergency calls come later. So if we have any 911 call in the queue, those non-emergency calls have to wait. And a couple of years ago, when our 911 calls were waiting so long, over a minute, sometimes 3 minutes in cases, when that was happening, our non-emergency queue easily was 30 minutes or an hour.
Yeah. 311 has been a help to your team.
Absolutely, and because of that, we're looking at our non-emergency wait times right now is around 2.5 minutes compared to 30 minutes or an hour.
Yeah. The city faces a tight budget year. 311 could have to deal with that. Mm-hmm. If 311 is scaled back, what kind of impact do you think that could have on the 911 center?
You know, without knowing what their scale back process would look like, my estimation would be that they would reduce their hours of operation, which would mean then that my staff would be handling those calls during hours that 311 would normally be in operation. And that would have an impact on our call answering times.
Every bureau in the city could be up for cuts given the budget situation. How concerned are you about budget cuts to the 911 center?
You know, I am concerned. I don't want to see any cuts. No director of a program wants to see cuts to their program. When I consider the package that we submitted, that package includes some things that don't impact staffing directly, but they do impact, you know, our facility security, for example, or other non-employee related activities. But that's really just a drop in the bucket when you look at the amount of money that we would have to pull from our budget. The biggest amount that would have an influence would be reducing about 10 positions. Now, our plan is not to, you know, if those cuts are accepted, it's not our plan to lay anyone off because we know we can count on a specified attrition level, and it would be through attrition then that we would ultimately see those cuts. However, that would mean that we would have a similar hole to what we had a couple years ago, maybe not quite as deep, but it would still be challenging for us to dig out of, and it would be very difficult for our community, I think, to rebound from.
I've spoken to some city councilors who say they want BOEC to stay whole and maybe even grow a little bit. What kinds of conversations are you having with city councilors about your agency's budget?
You know, I haven't had direct conversations with city counselors up to this point. I have had opportunity to share conceptually what the impact would be in more public meetings. And, you know, when we talk about impacts to BOEC's budget, part of the required cuts would include cuts in overtime. Now, our overtime has gone down tremendously over the past couple of years, and right now it really is quite low by comparison. But we would have to cut overtime almost completely. And if we did that, that would have an immediate impact on 911 call answering times, because if you know, you're a call taker, you're scheduled to come into work, we're counting on you to fill a seat and to provide service for our community, and you're sick, you have to call in sick, we wouldn't be able to backfill and provide a dispatcher who would be required to stay on overtime to fill that seat.
When you gave your presentation to the Public Safety Committee of the City Council a couple weeks ago, they seemed really surprised at the progress you've made given the condition of other bureaus. You mentioned media coverage and the tough questions you subjected yourself to and the transparency you showed in detailing the issues. What exactly did you mean by that?
Well, you know, the community was suffering. A lot of people were complaining. A lot of folks contacted the media and wanted, you know, somebody to do something about it. We knew the hole we were in. We understood that we were not anywhere close to meeting national call answering standards, let alone even answering the phone in a reasonable amount of time. We recognized that in the moment, and when we were approached by the media, I just stood like I'm standing here today with you and let them know, here's the reason. And primarily the reason was the increase in 911 calls, burnout for our staff, and a reduction in staffing.
You think that had a positive impact on what you're seeing today?
Yeah, absolutely. We got the word out, and because of that, it generated a lot of interest for folks interested in this profession.
What expectations do you have of your bureau for the rest of the year?
Yeah, so a realistic expectation is that we continue to certify our trainees, continue to see reduction in the average 911 wait time. My personal expectation, though, is that I want to see us be able to answer the phone immediately. When you think about having to call 911 on the worst day of your life, what's a reasonable amount of time to wait? How many rings do you expect to hear? One ring when you're panicking, 2 rings, 3 rings. When we say 3 rings, that's about 10 seconds. Well, I want somebody to pick up the phone right away.